On the 208, we're all about answering your questions. Seems like COVID is our most popular theme of late. Well, at least for the last year and a half. We're going to stick with that theme. We've seen a lot of questions about COVID vaccine booster shots lately. Like who is eligible? Where can you get it? Do you need a booster shot for the original vaccines if they weren't effective? Or is that what that means, that you need that booster shot because, well, the one you got 6 months ago is waning? Today, Joe Paris spoke with St. Luke's Health to answer your questions and learn more about their new COVID booster program.
As the pandemic wears on, we continue to learn more and more about COVID and vaccines. Now we're learning more about the effectiveness of COVID vaccine immunity 6 months after doses are administered.
So far, our evidence is that it's less effective in preventing infection.
Dr. Jim Souza is the chief physician executive for the St. Luke's Health System. While research shows that vaccine effectiveness does drop off over time, which could lead to a greater risk of infection, Souza explains that vaccines are still incredibly valuable for a large variety of reasons. That cannot be understated.
When you talk about going, however, from infection to hospitalization and hospitalization to intensive care unit hospitalization and intensive care unit hospitalization to death, the vaccines are highly effective.
A comparison Dr. Souza uses to explain the vaccine effectiveness is comparing it to using a seatbelt while driving.
Wearing a seatbelt means that even if you get in a car crash, you're highly likely not to die. So too with the vaccines.
The conversation on vaccines is now moving towards booster shots. St. Luke's Health announced that they are now administering Pfizer COVID-19 booster shots for eligible groups. Those include Pfizer vaccine recipients who completed their initial series at least 6 months ago and are 65 years and older, age 18 and over who live in a long-term care setting, 18 and older who have underlying medical conditions, and 18 years or older if you work or live in a high-risk setting. But what if you didn't get a Pfizer vaccine? Can you get the Pfizer booster? Dr. Souza says likely no, but there is one major exception.
We do allow, mixing, if you will, of vaccines, specifically meaning Pfizer after Moderna, for the immunocompromised who are in the highest risk group that we've been offering third vaccines to already.
If you are not in that group but still wanting a Pfizer booster, Dr. Souza has this insight.
If you're not in the immunocompromised group, we're recommending that we see what develops here in the short term relative to Moderna and Johnson & Johnson boosters.
But why not just give everyone a booster now? Dr. Souza says it's partially about resource allocation and realistic impact that boosters will create.
We only want to give an injection and a vaccine when we need to. So we're just trying to match the regimen with the actual need that creates benefit.
Okay, so those that think they need it for the benefit, how do they do this?
So if you're going to go through the St. Luke's Health System, and if that's what you prefer to do, they ask that you go through MyChart or you call them to set up an appointment. Brian, they know that some people will try to walk in, but because of how busy right now, if you walk into St. Luke's for anything, including a flu shot, you could have some long waits, and you could wait so long that you might have to come back the next day. It is important to note St. Luke's is not the only place that you can get the Pfizer COVID booster. St. Alphonsus is also working with the program right now, and there's some other outside of the Treasure Valley systems that are also working on the booster. But there's a lot of questions I know about the vaccines as well as boosters from other companies. Our friends over at the Department of Health and Welfare tell us from the research they're doing and what they're really finding out in the know, Brian, that October is when we're going to find out a lot about the vaccines from the different brands and really how they interact with other brands, as we talked about on the show yesterday. In Europe, for example, they are mixing and matching, so to speak, different vaccine brands. That hasn't been certified for use in the United States right now, but it could be coming. So the research is going on how everything interacts.
And I know a lot of people are concerned that this is going to turn into a series of boosters, but we're still waiting to see how that plays out too.
No plan, is wait and see, but could be possibly like the vaccine that we have for the flu, could be a yearly thing, but we'll find out.
All right. Thank you very much, Joe.